Welcome to Washington Unplugged. I'm Sharyl Attkisson. President Obama meets with moderate Senate Democrats today as negotiations over health care reform continue. The administration still favors a public option, but the divide among Democrats is widening. Take a look at what White House Chief of Staff Rahm Emanuel said yesterday right here on Face the Nation.
One is he spoke to the issue of a public plan and why he thought it was important for competition. Because in many parts of the country where a single industry, it's a healthcare company rather, dominates 80%. That's where the largest premium increases are. Public option brings that type of competition and then therefore downward pressure on prices and costs. Second is he thinks it's important, but it doesn't define the entire process of healthcare.
So one question remaining, should the White House continue the fight for a public option or compromise for the sake of saving reform? Joining me now is Cato Institute's Director of Health Policy Studies, Michael Cannon, and Jennifer Palmieri, the Center for American Progress's Senior Vice President for Communications. Thanks for joining us. Jennifer, first, just a line, what is the Center for American Progress all about?
It's a progressive policy and research organization, about 200 people that work on developing progressive policy, healthcare, education, national security.
It takes liberal positions in general and supports healthcare reform.
Exactly.
Okay, so what's your group's position on a public option and where that's headed right now?
We support it, but I don't know that it is, but I agree with what Rahm Emanuel just said, which is that we think it's important, but we don't think it's the most important principle behind health reform. And we think the most important principle is that there's that you put cost controls in place so that eventually costs will go down, that federal spending can be contained, and that people get more, and that there's people actually getting more coverage. And having a public insurance plan that is likely to have lower costs than you would find in a private insurance plan may help do that.
Michael Cannon, the Cato Institute is a libertarian group which believes in a lot of hands-off on the part of the government. Is that accurate?
Well, yeah, it's a libertarian think tank founded in 1977 to promote the ideas of individual liberty, limited government, free markets, and peace.
And so what's your view of the public option, and what's wrong with what Jennifer said?
Well, what people mean when they say a public option is they're talking about a government-run health insurance program that would compete with private insurers to cover people under age 65. And the problem with that is that the government can't really compete on a level playing field with private insurance. The government can subsidize its own plan, it can heap costs on private insurers, and actually draw consumers out of private insurance, even though the government is offering an inferior quality product. And so the concern there is that eventually there won't be any competition because the government is going to drive all the private insurance companies out of business, and not by beating them in terms of offering a better product. But we heard Rahm Emanuel say that the government option is not going, isn't a sine qua non for the administration, and I think the reason for that is that the rest of this legislation effectively gives the government as much control over the private health insurance industry as a government option would do, because it requires people to buy coverage, it lets the government define what's going to be in that coverage, set the prices, and so forth. So once you've done that, you've effectively nationalized private health insurance.
Jennifer, briefly on the public option, a version that you would like, because there's several subsets under public option. How would that work? Can you say in simple terms, would anybody have the choice to choose a low-cost public option in addition to private insurance or their work insurance?
No, they wouldn't. It would only be a part of the reason why I think that some of Michael's concerns are not founded is it would be available to a very small population, because it would only be available to people who didn't get insurance through their employers. So if you don't get insurance through your employers, then you could go into what they're referring to as an exchange, and you could have the option of buying private healthcare insurance there, or you could provide the insurance that's provided by the federal government. So the number of people, the vast majority of Americans do get their health care through their employers. So it would only be a small percentage of people that would even have the option of using the public option for health insurance. But the idea is, if you have a public option in the pool, that it's likely to make the insurance, the cost of premiums keep in check.
Now, right now, negotiations are going on in the Senate, for example. I think exclusively among Democrats. They're negotiating among themselves. Is it accurate to say Republicans and Libertarians aren't even in the game at this point?
I think that's absolutely the case. I mean, they hope to get at least one, maybe more Republican votes in the Senate, but I think they'd be quite happy to get to 60 votes with nothing but Democrats. I think that the concern that Jennifer raised, or the argument she made about this only being available to a small number of the American public is a little it's a little off. And the reason is that the Medicare program, the Medicaid program, the state children's health insurance program, all of these government health care programs started out focused on a specific population and have been expanded over time. The Medicare program to disabled Americans, Medicaid up the income scale, and the S-chip, we've seen the same thing, always political pressure to incorporate more and more people, make them eligible for the program. And so I think we'd see the same dynamic with a new government health insurance program.
All right, 3 quick questions. I'm looking for a phrase or a one-word answer from each of you, okay, on my last questions. Number 1, will a major health care reform bill pass?
My guess is still no.
Yes.
Okay. Number 2, when? If it passes, okay, you say no, when would it?
I hope by Christmas, but it's possible it could go into next year, which would be awful, but it's possible.
If it passes, not this year.
Okay. And number 3, will there be a public option in the end, the traditional kind that Jennifer was speaking of? What do you think, Michael?
Well, I think what everyone is calling the co-op's alternative to a government option is really just the same thing as a government option. I think that could happen, and so I think it's possible.
What do you think, Jennifer?
I think what will happen would be what they refer to as a trigger, which is that if costs don't go down by a certain amount, say in 5 years, then a public option would be available. But I think it'd be something that will be phased in, not done immediately.
So probably no public option as it was originally proposed and thought of in your view.
Right.
Okay, you agree on that point anyway. Thanks so much for giving us your views. This is Jennifer Palmieri, Center for American Progress, and Michael Cannon of the Cato Institute.
Thank you.
Appreciate it. Moving on to the battle that's heating up in New Jersey for the state's next governor. Incumbent Jon Corzine, a Democrat, has a 10-point lead over the Republican challenger Chris Christie. And Corzine's getting help from President Obama, former President Bill Clinton, and Vice President Joe Biden. Biden scheduled a stump for Corzine at a rally today. Does Corzine have any reason to worry about his prospects for a second term? CBS News' John Bentley takes a look.
I don't think this is a referendum on the president.
This is a referendum on me and Jon Corzine.
That is one of the few things New Jersey Governor Jon Corzine,
Mr. Christie, has no plan,
and his challenger Chris Christie,
We've heard nothing about what he's going to do going forward.
agree on. But not everyone believes them.
I think that people will be looking at the New Jersey race as a referendum on the current administration.
Nolan McCarty is a politics professor at Princeton who says it is surprisingly tough for someone who is in the same party as the president to win in an off-year election.
Turns out that the president's party's lost the New Jersey governorship the last 5 times.
That's why Obama has sent staffers up to work on Corzine's campaign,
Joe Biden
dispatched the vice president to stump for him, and made an appearance himself.
There is nothing that's going to stop us, New Jersey.
Corzine's denial that this election is about Obama might be easier to understand if he hadn't put up all of these billboards, which almost look as if they're advertising an Obama-Corzine ticket. You don't have to go far to find them all over New Jersey.
Christie doesn't want this election to be about Obama either, because the majority of New Jersey's residents,
Thanks for being here.
like the president.
What can you do to help us?
His job will be to try and convince the independents that voted for Obama last year to back him this time around.
There's no question that both national parties consider this race to be crucial, a crucial bellwether as to what's going on and what it says about the midterm congressional elections coming up next year and President Obama's re-election campaign.
making tough decisions.
But that may be jumping the gun, according to CBS News elections director Anthony Salvanto.
If you have an incumbent running, the election is a referendum on the incumbent. So to that degree, you really see this being about Jon Corzine and his term in office.
He says the polls show that New Jersey voters are more interested in property taxes and local unemployment than in sending a message to Washington.
He's got, in many of these public polls, a very low approval rating and high negatives.
There you go.
So while both national parties will be eager to jump on the election as a referendum on Obama, the results of the race may only reflect the concerns of voters in the Garden State.
Nice to meet you, sir. Thanks for your help.
John Bentley, CBS News, Irvington, New Jersey.
And that's it for Washington Unplugged. You can catch us each weekday at 12:30. Thanks for watching. I'm Sharyl Attkisson. Check out my Follow the Money reports on the CBS Evening News with Katie Couric, including my next report tomorrow. See you next time.